Okay, so this is part two of my rant that I was telling you about. But this one should be a little bit shorter because I've pretty much said everything else I need to say in the other one. But anyway, to go on with my thought of that they want to sit there and pull a fast one on me because they they think they care, but yet you can see yet again they're all about the money. And I'm sorry, but they need to understand that not everybody has the money to do a number of things that goes on out there, and that includes to be seen by an oral surgeon. Tell me, if I didn't have any kind of insurance, what would have happened then? There are plenty of people out there in this country that not only don't have health insurance, but they don't have dental insurance and need to be seen by oral surgery or need to see a dentist to get a filling taken care of or a tooth pulled, but they can't because they don't have money. We have dental schools in this country that are supposed to be able to do this at low cost, but unfortunately not all areas of the country have access to these dental schools. And on top of that, they want to charge an arm and a leg because they're so desperate to make money. Something has to give because at some point, the system's going to collapse. I stall yet again because of the fact that I needed to figure out how to put my thought together on this. I'm sick and tired of the fact that on the one hand, you have people that say, well, the health insurance doesn't want to cover this or that, but yet at the same time, the minute that something happens, oh, now I need to use my coverage, and then, yet again, something doesn't get covered, or then if it does get covered, guess what? Now they have to look elsewhere. Well, the same thing happens with dental coverage, because one of the things that happened in July is that even though my medical coverage does cover some dental stuff, that procedure in July, they didn't want to take responsibility because of the fact that now more work was involved. And I get it. It only, like the dental insurance, it only covers very little. Well, what would have happened? Let's say that this thing was serious. It's not, but let's say that it was. If it had turned out to be serious, and I needed to go through other procedures like a biopsy and whatnot, and it turned out to be cancer, guess where it goes back to? My medical coverage. Who's responsible then? Who's responsible for making sure that this issue is taken care of? Whether it be minor or major, even though it's not bothering me. And like I said, all I wanted to do was get an opinion. And you want to sit there and drag in my dental insurance, which if I use is going to cover very little. And same thing with my secondary insurance, which is through the state Medicaid. Yes, I'm on disability, but that's a story for another day. And even though they're offering dental coverage for adults as well as medical care, just like the dental insurance through my employer, it covers very little. And in fact, I recently found out that the dentist that I had was no longer contracting. And then when I went to get an opinion from another dentist, as it turns out, within the same company of the dentist that I was supposedly assigned to, they're not even taking that insurance at all. But yet they take my insurance through my dental insurance, through my employer. Oh boy. This country needs to get its act together as far as making sure that everybody has access. And what I mean by making sure that everybody has access is that they need to be unified under one umbrella. Meaning, that dental needs to be covered the same exact way that coverage under medical is when they decide to cover. Because guess what? The teeth and the gums are part of the body. But given the way that the current system is right now, that is not the case. And I am here to tell you, as I told them, my issue is not a dental issue. It is a medical one. But where my primary care also got the idea that I also have a lesion on my tongue, that is false. And I am here to tell you the only reason that she put that in the note was to make sure that she could get the referral out for me, which, don't get me wrong, I appreciate it. Because even, and she didn't have to do that because she told me her hands were tied. As a primary care physician, she is limited, and I don't know who is limiting her, whether it's the corporate offices or the insurance companies, both, or who. But she shouldn't be limited to what she can and cannot do as a primary care physician in that respect. I understand that she is not a specialist, and that is fine. But I am to that point where I see I am going to have to go back to the way I had done things before. And that is make the call myself on deciding which specialists I need. And because I have a preferred provider organization, or otherwise known as a PPO, I do not need a referral. I have also since found out that with my secondary insurance, same thing. I do not need a referral. I am sick and tired of people thinking that they are doing the right thing by keeping dental and medical separate from each other when they need to be together under one umbrella. There are a number of people in this country who do not have access to either one of them, even in spite of recent law changes that allow for health insurance, which is great, but it does not provide for dental. And for those who are on Medicare, some of the people who have Medicare Advantage plans, they get these coverages very easily, but that is not the case for the American public at large. And this must change. I don't know how we're going to do that, because for whatever reason, this country, in spite of what polls may say of people saying that they want to have universal single-payer health care, that is not the case. If that were really the case, this country would have already had it. And if something doesn't change, the bottom is going to fall out even more than what it's already doing. And on top of that, the prices of healthcare need to be more transparent, just the way that dental care is. Why do I bring that issue up? Because, like I said, for the work that I had done in July, before the discounts, it was $4,000 that they expected me to pay for the work that had to be done. You don't get this transparency that easily in healthcare. Why is that? And even though there's supposedly laws on the books now to try to make that possible, they're still not being transparent with people. And when they are, they're still denying coverage to some of the people, both for necessary medications and procedures. And of course, a lot of that, I'm not saying all of it, but a lot of that has to do with the way that the doctor's offices work the claim. And I don't know who's messing that up in these cases, whether it's the doctor and the way they write the claims, or the billing or the staff who sits there and tries to get these authorizations. But either way, they are the biggest reason why things are denied. People want to say that health insurance, the reason that these denials occur is because of pencil pushers. Well, that may or may not be true, But I do know that there are doctors and nurses that work for the insurance companies. I don't know if something is similar said for dental insurance, where they have dentists on staff that make these decisions or not. But regardless, again, healthcare and dental care need to be under one umbrella. This has gone on like this as two separate entities for decades, and it must stop. Because if not, you're going to have even more people who will continue to not get access to the services that they need. Because next time, if the problem becomes something more serious, like cancer, you're going to have even more deaths coming aboard and lives that didn't need to be lost. This must change. And I urge all leaders, regardless of their political party or belief system, that if you really care about the people of this country, you need to work together to care for the citizens of this country before it's too late. Thank you. Hey y'all, so the reason for this video is because I want to address an issue that a lot of people have been complaining about, and that is the issue of the fact that a lot of the dental, I'm not sure how to word this. Anyway, the dental is things, dental coverage is not part of medical coverage. I don't know who came up with this idea to make it so that the mouth is separate from the rest of the body, but that's really dumb. And what's bad is when the medical issue occurs within that area, and you have doctors that want to insist that it's a dental issue. Okay, so here's why I bring this up. Let me show you something, and then you'll see what I'm talking about. Hold on a second. Okay, now with that said, that's a salivary gland. Now why it's like that, I don't know, but it doesn't bother me. Yeah, it's a little tender, but I mean, like I said, it doesn't bother me. So I thought, well, let me go ahead and get this checked out, because in case somebody asks, and excuse me for scratching here, but you know how that goes. And so the excuse that I've gotten now, including from talking to my primary care, is this. Because she's primary care, she cannot refer me to an oral surgeon. Okay. So I thought that was the end of the matter. And she was like, because of the various rules, I can't do that. And then she's like, but do you want me to go ahead and do it? Okay, fine. Even though, like I told her, I didn't want her to get in trouble. All right. Like I said, now mind you, this is a medical issue, not a dental one. I already saw a dentist, and their statement to me was, well, and this was a second opinion dentist, the one I saw in July for a tooth that I had pulled. He's the one who noticed it, but I was not having any issues with this thing, even for as far as tenderness, until after he touched my mouth. Now, I don't know how or why this occurred, but given that, because I wanted to make sure that this got checked, just because in case somebody else decided to ask me about it, I've thought, well, why not go ahead and get it checked further, just to see what it is, even though I don't intend to do anything about it, because, like I say, it's not bothering me. Of course, yes, I will be keeping an eye on it. All right, so now that I found this out from my primary care physician, she says to me, and what I mean about my primary is that she cannot give me a referral to an oral surgeon, because the way that things are, they're assuming that everything that goes on in the mouth is dental. Well, that's not the case. Like I said, there are certain things, even within certain things that go on and body parts that are even within the mouth that fall under medical. And one of them is a salivary gland. So I thought, well, maybe it must be my primary insurance, my health insurance, that's making this decision. Turns out it's not my health insurance, which I thought, but I'm glad they confirmed. So I have no idea who made this rule. And comes out that it's probably the offices, which is kind of what I thought, because they don't want to do their job. Well, so I decided I'm going to go ahead and take this to corporate of the company that oversees my primary care physician's office. And as she likes to state, it's not my practice. I can't, my hands are tied. I can't do this, blah, 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 blah. Okay. So like I said, she asked me if she still wanted me to go ahead and do, she said, do you still want me to do the referral? And I said, well, I said, that's fine. I said, but I don't want you to get in trouble. Because that's what, because when she said her hands were tied. So after talking to my health insurance, I said, well, I'm going to go ahead and call corporate. And I did. And of course, once they got me through to the person that I needed to speak to, her answer back to me was, after doing a little bit of digging, well, you have to defer back to your insurance because they're the ones who makes the rule. I don't know where people get this idea that it's always the insurance that makes these various rules, but that is not always the case. A lot of people have no idea how healthcare works. And unfortunately, they also don't know how dental care works. And neither side can get their act together for the best interests of the patient. Both of them, and this has both good and bad. Unfortunately, as we see in some cases nowadays, unfortunately, it's more to the bad than to the good. But it's about money, which, it's their money, and I get it. Doesn't mean I agree with it, but it is their money. And they have the right to decide how they want to use it, how they want to spend it, even though sometimes it may be to the detriment of the person involved. Again, it's not fair, and it's not right. But I want to know who it is that makes up these rules, and I don't mean just the offices, but who actually makes up these rules to sit there and tell me that I cannot have my primary care physician refer me to an appropriate specialist for an issue. This is ridiculous. Everybody's complaining about, well, health insurance is the reason for this and that. No, it's not always the health insurance. It also often has to do with the offices. Now let me continue with the rest of my story. After I had the conversation with a lady at corporate who said to defer to my insurance, as I was talking to her, trying to give her more information so that we could try to hopefully look into this further, wouldn't you know, I got a call from an oral surgeon's office. Now mind you, even before I got this call, my primary care physician says to me, if you don't hear from me with us in 5 days, give us a call. Well, I was not planning to do that because I knew the chances were that the referral was not going to take place. So I went ahead and called corporate because I needed to figure out who was making up this rule. Because if it was their corporate office, then I had a beef I needed to take with them on this issue and read them the riot act. Because even though this issue is not bothering me, I at least wanted to get it checked out just to see what the doctor thought, even though I have no intent to do anything about it, because like I said, it doesn't bother me. But I figured, well, like I said, get it checked out, because in case somebody says, well, have you had it checked out, because this doesn't look very good, and, at least just to make sure. Okay, well, as I said, as I was talking to this lady, I got a call from the oral surgeon's office. So I finished my conversation with the lady at the corporate office. And then after I had the conversation with the oral surgeon, expecting that I was going to be able to make the appointment and get an appointment so that at least I could get this looked at. And I told the lady there, I said, all I want to do is just come in and have it looked at just to see what they think. I said, I don't have any intention to do anything about it. I said, because it's not bothering me. I said, but I just wanted to get somebody to look at it. Well, wouldn't you know, her next question to me was, do I have dental insurance? Well, yeah, I have dental insurance through my employer. But like most dental insurances, they cover very little. And I know this because of having had the issue with my tooth being pulled in July. With the amount of work that had to be done, not only to pull the tooth, but the other steps that needed to cover the area involved, because this was a big tooth, the total number of money amount was $4,000, and then with asking for a discount, got it dropped down to about $1,000. Well, I'm sorry, but I don't know where people get this idea that think that just because somebody has a job, that now they have money to pay for this and that, and including for dental procedures or out of pocket for health coverage procedures that after the insurance pays their portion. Yeah, I'm stalling because I'm annoyed and I have to figure out where I want to take this thought next. Because this issue of dental not being part of, dental issues, teeth, gums, not being part of medical has been going on for decades, if not centuries, because of the fact that somebody way back when figured, oh, well, the mouth, the eyes, the ears are not part of the body. And it wasn't until recently that we're starting to understand that they are part of the bodies, but yet neither medical nor dental can seem to catch up to this fact. Which is why we still have it considered as basically that dental can charge whatever they want, anytime they want, for anything they want, any day of the week. Well, like I said, this oral surgeon asked me about my dental insurance, and like I said, I told her, yeah, I did. But I said, given the way that they work, I said, they're not going to pay very much. And I said, tell me. I said, even if I told you that the diagnosis was TMJ syndrome, which is also a medical diagnosis, you would still tell me that I need to have my dental insurance? And she's like, yeah, as a matter of fact, you would. I said, okay, well, in that case, I said, you know what? I said, I'm not even going to waste my time. I said, because, like I said, this thing doesn't bother me. So why am I even going to bother? Well, she's like, okay, well, then we're going to let your primary care physician know, and they will call you shortly. I said, there's no need for them to call me shortly. I said, because there's nothing left to be said. Well, let me take this one step further. When my primary care physician looked at this area, I didn't realize until this lady told me that on that referral, not only did she mention the salivary gland, which is a medical issue, but she's like, there's a lesion on my tongue, or on your tongue. I told the lady, I said, no, there's not. I do not have a lesion on my tongue. I may not know everything about medicine, but because of my background professionally, I know enough, including not only about that, but my own body in particular, that if there was a lesion on my tongue, I would know it. But there is no lesion. And even when I went to consult that other dentist to get an opinion about this, they never stated that there was a lesion on my tongue. They said it was a blood vessel that's being like this. And, I'm sorry, I am so over this. And there was a point in time where, for a time, I did not have a primary care physician. And that was to my advantage in part because my health insurance is a PPO. So I don't need referrals to go anywhere. But a number of the doctor's offices in my area are trying to require this. Their excuse is that because there's a doctor shortage in this area, that they have to have referrals in order for people to come in because there's a doctor shortage. You know what? I don't buy that for a second. I live in one of the largest cities in the United States of America. And yes, I'm very proud to be an American. Hi, America, I love you very much. Don't get me wrong. But what I don't like is when you cannot make up the information in a way that's honest. And it's all about money. That's all it is. And I'm telling you right now, everybody that wants to talk about universal health care is saying, oh, but if we had universal health care or single payer health care, we wouldn't have these problems. Well, let me tell you something. You would be wrong about that because instead of it being the health insurance that does this or the dental insurance that says no to covering things, it would be the government or some other entity doing the same thing. And, there's always got to be a bad guy in this, I guess. But really? You're going to sit there and try to pull a fast one on me?